The patient summarizes responses during hypnotherapy to such indications that prompt the patient to physically show by raising an index finger, Nongard, 2007, and to help with future sessions of partial work, if necessary. The literature offered by Alladin, 2008, p. 103, explains how the majority of patients with anxiety disorders, as addressed in this case study, also learn to strengthen the hypnotic relaxation experience as a confidence-inspiring tool. In the medical history, the patient showed a significant degree of demoralization manifesting in anxiety, leading to physical signs of mild depression and hopelessness associated with the obvious despair of her reason for the session. In addition, analysis of the data revealed that coping patterns related to the internal responses of the target study to the indicated research mechanism have a greater potential for adaptability to external type evaluation variants. As a result, any perception of meaning attributed to a particular episode that causes anxiety and uses coping skills turned out to be significant as oppressive negativity, whereas the interaction with the place of control turned out to be insignificant. Prior to this case study, the patient sought my services on the basis of a positive reference from a friend of a trusted family member's friend, the patient-to-patient alliance, focusing on the nature of the task and the patient's willingness to focus on the process to be decisive. However, the conscious cognitive version of this report may be subject to a subversive unconscious response to therapy. Merton and Arrington, 2005. While certain trends in the 21st century prove to be argumentative when current practices attempt to compare psychotherapeutic outcomes with drug outcomes, this continues to be a complicated and even dramatic development in the medical social science of mental and emotional disorders. Leeds, Bryant et al. 2005. In the case study presented here, the basics of home culture clearly show how their fear for performance spread and grew. The cultural conditioning of generation aspects of patient life at home, and probably also social conditioning. 1967. 4 sessions in which the patient applies eclectic and pluralistic hypnotherapeutic intervention using empirical observational rules and the results of the sessions to determine the cause of the anxiety that the patient experiences when performing academic text tests proved to be a successful process. In the general discussion, the patient demonstrated a positive control area and reported on how she continues to shape her own life and is no longer subject to external factors that previously detained her in academic and life goals. The patient reported the beneficial effects of this presentation on patient behavior and the successes she discussed in her personal and academic goals, consistent with therapeutic intervention. Since the mentioned patient still suffers from tolerable but problematic anxiety during some school examinations, the decision was made to use the mental control room as well. Hammond, 1990. We again report successful treatment of acute interstitial cystitis with SDSH, this time at long range, relying solely on Skype and confirming the perceived results with by tests. As with most psychotherapies, SDSH leads clients in a relaxed state to the significant time in their emotional memory when the specific health problem occurred. Emotions associated with the problem then emerge, and when addressed directly in the subconscious, generates a considerable amount of psychological relief. Hypnotherapeutic suggestions can help clients break old habits on a subconscious level. During hypnotherapy, suggestions can be made to consider new patterns of behavior in terms of times, locations, and reasons for eating. There are some people who are overweight, a symptom of something deeper, and the therapist may use analytical tools such as regression or dissociation. Various pharmacological treatments have been used to gradually reduce smoking behavior. Nicotine replacement products such as Nongard have been used with mixed results and are in the form of nasal spray, chewing gum and patches. However, the benefit of hypnosis is that patients can better control their behavior and the therapist can alert them to the motivation factors behind smoking cessation and use that power during treatment. For example, Carmody and colleagues, 2008, compared behavioral hypnotherapy, in which nicotine patches were also administered to both groups. They found that hypnosis was not clearly effective in voluntary, hedonically rewarding behaviors such as obesity, cigarette smoking, and alcoholism. Hypnosis, however, resulted in unique treatment effects on involuntary, non-hedonically rewarding behaviors such as pain, warts, and asthma. Hypnotic susceptibility was found to be related to treatment outcome for the latter group of problems. During my final year of study, when I was studying a hypnosis module, my interest in the field developed.